Hello, I'm Ty Mason of the DiabetesCouncil.com, researcher, writer, and I have type 2 diabetes. Now I want to emphasize that my perspective is coming from one with type 2 and not type 1 diabetes. Our channel is primarily for those with type 2 diabetes and pre-diabetes. Today, I want to answer the question, I had gestational diabetes. Should I be screened for pre-diabetes regularly? After you watch the video today, I invite you to check out the description box for my new ebook. This is one of the most comprehensive diabetes meal planning books you can find anywhere. It contains diabetes-friendly meals and recipes for different goals such as 800 to 1800 calories per day meal plans, diabetes meal planning tips and tricks. There are also tons of diabetes-friendly recipes for everyone. I have a video on who should be screened or tested for pre-diabetes, and having had gestational diabetes was on that list. So yes, you should be. But I want to spend some time today on the why and how often. You see, nearly 1 in 10 women, or around 9%, develop gestational diabetes during their pregnancy, according to the Centers for Disease Control and Prevention. This forces the pancreas to work overtime to produce insulin and can increase the size of the baby, which may lead to injuries during childbirth for both mom and baby and increase the likelihood of a surgical C-section. Fortunately, when gestational diabetes is well controlled, pregnancy complications can be avoided, and for most women, blood sugar levels return to normal immediately after delivery. However, while that may put diabetes in the rearview mirror and then out of sight and out of mind, for new moms in the flurry of parenthood, the reality is the risk extends forward. Depending on the study, women with a past history of gestational diabetes have between a 35 to 60% risk of developing type 2 diabetes within the following 5 to 10 years. Now I know that's a broad range, 35 to 60%, but so many studies and with the research I found, both were pretty reliable. Now women with a history of gestational diabetes are estimated to have 7 times the risk of developing diabetes compared with women who didn't have gestational diabetes. Experts also emphasize the first step for women who've had gestational diabetes to prevent developing type 2 is regular screening. You can't treat a problem if you don't know you have it. Now, guidelines from the American Congress of Obstetricians and Gynecologists and the American Diabetes Association recommend women who've had gestational diabetes be screened at 6 to 12 weeks postpartum. The gold standard for testing for gestational diabetes, diabetes and prediabetes, and the most sensitive screening tool used is the 2-hour oral glucose tolerance test. Patients who have blood drawn and then drink a sugary or glucose-infused solution before having another blood draw 2 hours later then test the body's ability to use glucose. If testing results are normal, well, the ADA recommends that women with a history of gestational diabetes undergo a diabetes screening at least every 3 years thereafter. Given that many women are hesitant to go back for the involved oral glucose tolerance test, the second best option is the fasting blood glucose test. That can either be done with a blood draw or even a finger stick, and women must fast for at least 8 to 12 hours before the blood test. Now, while simpler diabetes screening tests can be done at a variety of venues, from health fairs and employee-sponsored clinics to doctor's offices, experts do emphasize the importance of speaking with a person's primary care provider about those results. Experts also note that more convenient testing is less sensitive and recommend women with a history of gestational diabetes talk with their health care providers to determine whether more frequent diabetes testing is appropriate. Now, screening is just the first step. If you have had gestational diabetes, you really should look at some lifestyle changes. These changes are to lose weight, exercise more, and eat a healthier diet. Along with these lifestyle changes, the American Diabetes Association guidelines recommend that the medication metformin be considered to treat prediabetes in women who have had gestational diabetes. However, research finds that just under 8% of those women with prior gestational diabetes who have prediabetes actually got a prescription for metformin. It is well documented that metformin is underutilized in prediabetes treatment in general, as well as in women with prior gestational diabetes. Speak to your doctor about metformin. Don't forget to get my new ebook, and please subscribe to our channel for many more videos like this one in the future. I want to thank you so much for watching. I'm Ty Mason.